Cancer is any of a large number of conditions characterized by the growth of abnormal cells that separate uncontrollably and can enter and destroy normal body tissue. Cancer can usually spread throughout your body. Cancer is the second leading cause of death all around the world. But survival rates are improving for multiple kinds of cancer, thanks to cancer screening, treatment, and prevention advancements. Keep watching today's video on parshealthhtv to learn more about this disease. Factors that increase the risk of cancer. Cigarette smoking and tobacco use. Tobacco usage is extremely connected to an improved chance of cancer. Smoking cigarettes is the major cause of the following kinds of cancer: acute myelogenous leukemia, AML, cervical cancer, bladder cancer, esophageal cancer, lung cancer, kidney cancer, oral cavity cancer, stomach cancer, pancreatic cancer. Not smoking or quitting smoking reduces the risk of cancer and dying from cancer. Scientists think cigarette smoking generates about 31% of all cancer deaths in the US. Infections. Specific viruses and bacteria can lead to cancer. Instances of cancer-causing viruses and bacteria are: hepatitis B and hepatitis C viruses raise the risk of liver cancer. Human papillomavirus, HPV, boosts the chance of cancers of the cervix, penis, anus, vagina, and oropharynx. Helicobacter pylori improves the risk of gastric cancer. Epstein-Barr virus boosts the chance of Burkitt lymphoma. 2 vaccines to stop infection by cancer-causing agents have already been created and approved by the U.S. Food and Drug Administration, FDA. One is a vaccine to prevent infection with the hepatitis B virus. The other defends against infection with strains of human papillomavirus, HPV, that generate cervical cancer. Scientists continue to work on other vaccines against infections that cause cancer. Radiation. Being exposed to radiation is a leading cause of cancer. There are 2 main kinds of radiation connected with a raised risk for cancer. Ultraviolet radiation from sunlight. This is the leading cause of non-melanoma skin cancers. Ionizing radiation. Medical radiation from tests to diagnose cancer, such as X-rays, fluoroscopy, CT scans, and nuclear medicine scans. Radon gas in our homes. Scientists believe that ionizing radiation generates leukemia, thyroid cancer, and breast cancer in females. Ionizing radiation can also be related to myeloma and lung, colon, stomach, esophagus, bladder, and ovary cancers. Exposure to radiation from diagnostic X-rays increases cancer risk in patients and X-ray technicians. Diagnostic radiation in kids and adolescents has been connected with a higher risk of cancers at a young age. The growing use of CT scans over the last 20 years has raised exposure to ionizing radiation. Cancer risk also rises with the number of CT scans a patient has and the radiation dose utilized each time. If you like the video, give a thumbs up button, and never forget to subscribe and click the bell icon. Factors that may affect the risk of cancer. Diet. The foods that you consume regularly make up your diet. Diet is being examined as a risk factor for cancer. It is hard to study the impacts of diet on cancer because an individual's diet contains foods that may save against cancer and foods that may raise cancer risk. It is also hard for people who participate in the studies to keep track of what they consume over a long period. This may clarify why studies have various results about how diet influences cancer risk. Some studies have revealed that a diet high in fat, calories, proteins, and red meat raises the risk of colorectal cancer, but other studies have not indicated this. It is not known if a diet low in fat and high in fiber, fruits, and veggies reduces the risk of colorectal cancer. Alcohol. Studies have indicated that drinking alcohol is related to an increased chance of the following kinds of cancers: oral cancer, breast cancer, esophageal cancer. Drinking alcohol may also increase the risk of liver cancer and female colorectal cancer. Colorectal cancer, in men. Physical activity. Studies reveal that physically active individuals have a lower risk of specific cancers than those who are not. It is unknown if physical activity is the reason for this. Some studies indicate that physical activity saves against postmenopausal breast cancer and endometrial cancer. Obesity. Studies show that obesity is related to a higher chance of the following kinds of cancer: postmenopausal breast cancer, endometrial cancer, colorectal cancer, esophageal cancer, pancreatic cancer, kidney cancer. Some analyses demonstrate that obesity is also a risk factor for gallbladder and liver cancer. It is not known if losing weight reduces the risk of cancers that have been related to obesity. Diabetes. Some studies show that having diabetes may slightly raise the risk of having these kinds of cancer: bladder cancer, colorectal cancer, breast cancer in women, endometrial cancer, lung cancer, liver cancer, oral cancer, ovarian cancer, oropharyngeal cancer, pancreatic cancer. Diabetes and cancer have some of the same risk factors. These risk factors are: being older, smoking, having obesity, not exercising, not eating a healthy diet. Because diabetes and cancer have these risk factors, it is hard to know whether the risk of cancer is raised more by diabetes or by these factors. Studies are being done to find how medicine utilized to treat diabetes influences cancer risk. Environmental risk factors. Being exposed to chemicals and other substances in the environment has been connected to some cancers. Links between air pollution and cancer risk have been discovered. These include connections between lung cancer and secondhand tobacco smoke, outdoor air pollution, and asbestos. Drinking water that contains a large amount of arsenic has been linked to skin, bladder, and lung cancers. Studies have been accomplished to notice if pesticides and other pollutants raise cancer risk. The results of those analyses have been unclear because other factors can alter the outcomes of the studies. When to see a doctor. Make an appointment with your healthcare provider if you have any continued signs or symptoms that concern you. Discuss your concerns with your doctor if you don't have any symptoms or signs but are worried about your cancer risk. Ask about which cancer screening tests and methods are appropriate for you. Share your ideas and experiences about cancer in the comment section below. And please share our videos with your friends to support our team. Looking for more amazing videos? Check out the videos popping up on the right and the left of your screen. Thank you, guys, for tuning in. Hope you have a wonderful day.